speak to you about stress. How many of you felt like this while preparing for your informative speech? I can tell you right now that this is how I feel on the inside. How many of you feel like this at least once a week or at least once a month? Stress affects our lives on an almost daily basis. It could be something as major as a pending divorce or a life-threatening illness or something minor, being late for class or waking up late. In a 2007 American Psychological Association survey, 32% of people surveyed said they experienced extreme levels of stress, and 1 in 5, roughly 17%, experienced stress for 15 or more days per month. What are the reasons for this, and what can be done to reduce the stress in our lives? Today I would like to first discuss what stress is and its various causes. Second, I would like to inform you about the physical and emotional effects stress has on our minds and our bodies. And lastly, I will present some coping mechanisms that can help us all deal with the physical and emotional side effects of stress. Let's begin by learning about what stress is and its causes. As I stated before, there are several causes of stress. According to the Merriam-Webster Dictionary, stress is a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. In stress reactions, the brain releases hormones that essentially send the body into survival mode. According to scientist J. Douglas Bremner, stress hormones cortisol, norepinephrine, and adrenaline are released and sent throughout the body. According to Mr. Bremner, the hormones cause the heart to beat more rapidly, blood pressure to increase, heavier breathing, and increased blood flow, which I'm sure are symptoms that most of us can relate to, because I'm feeling them right now. A little bit of stress is actually good for you because it tells your body when to react. However, too much stress can have negative health effects on your body. Some of the causes of stress, as we stated earlier: money, health, relationship problems, school, family, and the list goes on. Different stresses are different for different people. I just totally lost my place, I'm sorry. The attacks on September 11, 2001 actually presented a relatively new cause of stress to the general population: post-traumatic stress disorder, also known as PTSD. According to a November 15, 2001 survey of stress reactions published in the New England Journal of Medicine, 90% of those surveyed reported one or more symptoms of stress after the 9/11 attacks. So as we can see, there are various causes of stress. Now let's take a look at how stress affects us physically and emotionally. Stress creates physical effects that can be detrimental to our well-being. Some of the physical effects include tension, insomnia, headaches, reduction of immunity. Some of the emotional or psychological effects include poor focus, irritability, anxiety, and depression, just to name a few. Stress has been linked to several diseases such as diabetes, cardiac problems, severe depression, and anxiety disorders. One of the top psychological diseases that has been linked with stress is panic disorder, which, according to Dr. Benjamin Root in his book Panic and Other Anxiety Disorders, is that of having distinct episodes of intense anxiety which develop abruptly and seemingly lack an adequate participating factor. Panic disorder can be caused by high levels of stress, but also contributes to stress in one's life due to fear of the attacks occurring. So what can we do to alleviate some of the stress in our lives? Let's take a look at some coping mechanisms we can try to help alleviate stress. Although we can't completely erase stress from our lives, according to the APA, there are many effective techniques we can use to alleviate it. Learn your stress triggers. What are the causes of your stress? As I stated earlier, stress triggers are different for different people. What might be considered stress in your life may not be considered stress in someone else's life. I can tell you that as a single mom with 3 children, I have daily doses of stress all the time, which for a lot of you that might not be considered a stress because you don't have children. Someday you'll understand. Learn your stress signals. How does your body and mind react to stress? What What are your physical symptoms? Do you exhibit any of the symptoms that I stated earlier? It's important to know this to effectively take care of the problem. Taking care of yourself. Exercise is one of the most beneficial things you can do for yourself when you're stressed. Also, good eating habits, getting plenty of rest, and learning time management skills, and practicing relaxation techniques such as yoga or meditation, all can help relax your mind and body. Get help if needed. Talking with friends and family can be a great way to help get things off your mind and put things into perspective. And seeking professional help. Many people don't seek professional help because they see it as a sign of weakness. It is not. These professionals are here to help you get things off your mind and can help you put things in a better perspective than you might have been able to. In summation, stress is a part of our everyday lives. Too much stress can have serious consequences on our future health, as well as how we function on a day-to-day basis. Today we have learned about what stress is and how it affects us physically and emotionally, and what we can do to help reduce stress. It is my hope that everyone here has a better understanding of how to identify their own stressors, and perhaps next time you're feeling stressed out, give one or two of the coping mechanisms a try. And if they don't work, you can just add it to the list of things that stress you out. Thank you.